Good evening, good evening. Let me get my caller right. Good evening, everybody. Good evening, good evening, good evening. Welcome, 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 welcome to join us on tonight. We're excited. We're going to share about the power to end stroke, Power Sunday. My name is Michael Miner, and I am the National Director of the National Baptist Convention USA Incorporated Hope Health Ministry. And we're glad to have all of you all that are joining us tonight by virtue of Zoom, Facebook, and YouTube. And we're going to do our best tonight, as we always do, to check our social media platforms to field any questions that you will have. We have an exciting group of panelists tonight, a lot of good information, and we're certainly hope that you're ready to learn and share on tonight. Now, we're excited because this evening's webinar is hosted by our NBCUSA Hope Team Detroit. As you may or may not know, we're starting to go into regions, and this is our first one we have with our regional team, and we're so glad, as some people call Detroit, Mississippi North. We're glad to have them to share about what their team members are doing. We're going to talk about Power Sunday 2021, and we're going to conclude, as we always do, with a Q&A that you all can participate in. All right. Now, what I'm going to do first, we're going to introduce our panelists. And as I do so, I'm going to highlight each one. And remember tonight, you know, those that are on Zoom, that are on Facebook, don't be shy. If you got questions or comments, put them in. We're going to do the best that we can. But we're going to go through each one of our panelists first, and then we'll come back for the Q&A. All right. Well, we're going to begin our introductions tonight. And let me add the spotlight. So our first panelist is Teresa Felsfire. She likes to make sure I always calls her Teresa. And she is a faith community nurse. She is also our Midwest coordinator for the National Baptist Convention USA Incorporated Hope Health Ministry. She's a member of the New Ebenezer Baptist Church in Detroit, Michigan, where our pastor is Reverend Dr. Wallace R. Mills Jr. And she's very supportive and active part of the initiatives for not only her church, but the community. She gives leadership to the health ministry. She is a pre-diabetes lifestyle coach and an advanced care practice directive specialist. Woo! And she also has her instructor certification through the Sunday School Publishing Board of the National Baptist Convention, USA Incorporated. Welcome tonight, Teresa.
Thank you. I am so pleased to be here. I'm honored.
All right. Now for our next panelist, Janet Banks McElrath, Faith Community Nurse Coordinator from Henry Ford Health System. She's a seasoned, enthusiastic healthcare professional with proven leadership skills to transform organizations. She's experienced in connecting consumers with communities and bridging the gap in the ever-changing healthcare environment. A strong commitment to high standards, service excellence by promoting engagement, woohoo, the best practices and outcome. Jen is a certified healthcare planning instructor and has taught the Respecting Choices curriculum to healthcare professionals. Respecting Choices is a comprehensive program designed to instruct medical professionals on how best to create, communicate, and honor patient care wishes. Welcome tonight, Janet.
Thank you. I also want to add that I am a member of New Calvary Baptist Church in Detroit, which my pastor is Reverend J.T. Thomas.
All right, the shout out to the pastor. Okay, thank you. All right, thank you. All right, now we're going to go to Kristen Hurley, the American Heart Association Metro Detroit Executive Director. She's responsible for the fundraising and community engagement programs that create longer, healthier lives for everyone who lives in Southeast Michigan. Kristen has 9 years of experience before she came into this position with the American Heart Association. Her most recent experience prior to becoming executive director was as senior director of community impact in Detroit. She has co-led the market's board of directors with the previous executive director, oversaw a team of community impact directors, and developed much needed corporate and foundation partnership with the Balmer Group, Michigan Health Endowment Fund, and Enterprise Community Partners. Ladies and gentlemen, Kristen Hurley, welcome.
Thank you. Thank you for that. Thank you so much for having me. We're so happy to be participating with all of you this evening. And so very excited to be a part of the panel. And thank you so much for having us for this great event.
Thank you. Thank you. All right. And last but never least, because he's got the right name, Michael Randall, the Director of Community Impact at the American Heart Association there in the Detroit area. In his position, Michael engages in collective community impact efforts, both leading and supporting in partnership with key volunteers, strategic alliances, institutions, and corporations. He works to build and implement a cross-functional strategy addressing American Heart Association's areas of interest. He also works to identify and assist in recruiting diverse volunteers to serve in leadership roles on market board of directors and event executive leadership teams. Ladies and gentlemen, Michael Randall. Welcome, Michael.
Thank you, Michael, and thank you all for having us. Very excited to be here to share this very timely and important information. So thank you all for joining online as well.
All right, thank you, thank you, thank you. All right, and then of course we'll have all our Hope team. They're on here with us. You know, Linda, Sister Carper, you know what your deal is. You make sure you're checking our Facebook page. I got the YouTube page up, and we're going to do the best that we have. We do want to acknowledge our partners in sharing on social media. Our state convention, Mid-South Churches Cooperative Conference, Baptist State Convention, the National Faith-Based Mobilization Network, Oak Hill Regional Community Development Corporation, and various others who have so generously shared tonight's webinar. Thank you, thank you, thank you. And so tonight we want to, now that we did those introductions, I saved that part because I wanted more folks to be on here for this. I do want to acknowledge our leader of the National Baptist Convention USA Incorporated, Dr. Jerry Young, who reminds us that we must envision the future exceptionally. Our General Secretary, Dr. Alvin Edwards, and the chair of our federal faith-based initiatives, Dr. Alvin Love, and of course, all of the team members all across the country of your NBCUSA Hope team, we're glad to be here. All right, everybody, let's get started. I think we're about ready to go. All right. So let me bring up Teresa. All right. All right. So last year, we formalized our regional structure. And our Midwest region includes, let me read this so I get it right, Illinois, Indiana, Iowa, Michigan, Missouri, where you are, Wisconsin, Ohio, West Virginia, and Minnesota. Now look, this is from our parent body. People say, West Virginia is Midwest, but anyway, that's where the regions are. And we're blessed to have an inaugural point person in Sister Teresa Fales-Farr. She's our coordinator. Welcome to our team, Teresa.
Thank you so much, Dr. Miner, and thank you to all the panelists and the speakers tonight.
All right. Well, look, let's start from brass tacks. How did you get started with Hope? Did it just all of a sudden just pop out of thin air, or what? How did you get started with us?
Well, no, I've always been a part of the National Baptist, and I was part of the nurses, but then I decided that we needed some more resources. So I saw Hope Health Ministry on there. And since I was giving leadership to the health ministry at my own church, I said, oh, this is perfect. So I sent an email to you and got a response. And you were having some training sessions that was coming just in time. It was wonderful. And I became a part of the Hope Health Ministry and have had some awesome seminars and webinars. It's been wonderful.
Beautiful, beautiful. So since you talked about that, you participated in the virtual training. How has that experience been for you?
Well, of course, it was quite new for me. I was used to in-person instruction. So this is different for me. And probably everybody can see with this gray hair, I'm a little elderly there. So
you're seasoned. You're seasoned.
Okay, I'm seasoned. I accept that.
Okay.
And it was really a different experience, but it was an awesome experience because I still got to meet people. And we learned a lot. You had so much information on there. And even being a seasoned nurse, there were some things that I really had forgot about, wasn't aware of. And so the training is just invaluable.
Wonderful, wonderful, wonderful. All right. So now what is the Hope team? I know y'all just got started, but has the Hope team Detroit done anything over the last year? And
Oh, Hope Team Detroit is on the move.
Oh.
We're on the move. There should not be any hungry people in the Detroit metro area or the state of Michigan. Now, if it is, it's because we're not getting enough resources out there, and we will work on that. But our churches are busy. They are providing food boxes with staples, with canned goods, fruits and vegetables. We have all types of food out there. At least one day a week, you can find churches all over that are providing this service. I would say any day of the week. They just need to get the contact information. Okay. We're also providing education on COVID-related issues. We're doing PPE, which is the protective personal equipment in terms of masks and hand sanitizers.
Okay.
Now, with the masks, we received a donation of 20,000 masks.
You're wrong. You mean 2,000, right? You don't mean 20,000. That's a lot of masks.
Oh, no, I mean 20,000.
20,000. Wow.
Yeah, I think so. I think those came from the Hope Health Ministry.
Oh, okay.
Yes. And I was shocked because when I told my pastor we had some masks coming, we had no idea it was going to be like that. But it's been a true blessing. We have provided other churches with them, the community with them. We've been able to get some to some schools, and it's just been a blessing to a lot of people. Wonderful. And we thank you for that.
All right. Okay. Well, now
if I can, I'm sorry. I just wanted to give a little shout out to a few of the churches that are really on the move. And besides New Ebenezer in Detroit, there's El Bethel in Redford, New Bethel in Detroit, Christland in Detroit, Messiah in Detroit, Mount Calvary in Flint, Galilee in Detroit, True Love in Detroit, First Trinity in Flint.
True Love.
Yes.
That's Trinity, my cousin over there. Yeah.
In Pontiac. Yes. You were there last year or a year before.
Right.
Hopewell in Pontiac, New Light in St. Clair Shores, and New Testament in Ypsilanti. That's just a few.
Wow.
We have a lot more, and I know we have other things to do, but we have a lot more. But what I'm asking is, now that I'm in this position and it's new to me, I would like for the churches and the leaders to reach out to me, please, so that we can try to put something together so that we can start meeting virtually, find out what you need so we can lead you towards training and resources with the Hope Health Ministry. So I'm sure my contact information will be available through the network.
Yes. Yes, and I say so right now, so it seems like Janet's gonna be busy. Okay.
Yeah.
Thank you so much, Teresa. Welcome to our team. Thank you. Thank you. All right. Now let's go to the second part of what we talk about on tonight, and that's going to be dealing with stroke. Now let's talk about Blacks and stroke. Okay. Now look at those, some people jumping on me. You didn't say African American. Well, supposedly now we've changed. We no longer now say African American. We're now Black. I remember we were Negro and then we were colored. But anyway, so I'm using the word Black. That's what we got up here. Okay. Nearly 800,000 people in the United States have a stroke each year, making it the third leading cause of death in this country. Obviously, we know this was before the pandemic hit, right behind heart attack and cancer. And statistics show that Blacks are at a greater risk than other groups. According to the National Institute of Neurological Disorders and Stroke, Blacks are two to three times more likely than their white counterparts to have a stroke. Wow. Blacks are more likely to suffer a stroke at a younger age, have a higher mortality rate from stroke, and often take longer to recover than whites. Black women have the highest stroke rates of all, surpassing that of Black men as well as white men and women. While overall deaths due to stroke have dropped by nearly 30% over the past several years, the numbers have not been as significant for people of color. Blacks saw a 20% drop in the death rate from stroke versus 25% for whites, which represents hundreds of thousands of Blacks who are still at risk for dying of a stroke. According to the Centers for Disease Control and Prevention, the overall drops in death rates are associated with lifestyle changes such as healthier diets, more exercise, as well as better medical management of cholesterol and high blood pressure. Remember, you don't take your high blood pressure medicine and your cholesterol medication so you can eat what you want. It is all part of a regimen to help you to be healthier. So the question is, are Blacks getting the message? All right, and to help us to start along that line, our next three panelists are gonna work with us on that. So let me add on here to the panelists. All right, Janet from the Faith Community Nurse Coordinator from Henry Ford Health System. All right. Now, look, before sharing about Blacks and stroke, there's some folks out there want to know what is a faith community nurse and what do they do?
Well, I'm glad you asked me that. Faith community nurse is, we are trusted messengers. Nurses are, you know that, right? And we do have, our network is comprised of people who are volunteers, nurses, and lay health ministers. They're not only nurses, they're people who really care about health. So we have people from all walks of life, but we educate them on the message. We make sure that they possess the toolkit. But the nurses that are in the church are the ones who educate. We meet the congregation needs in respect to health promotion, health screening, referral resources, counseling, and integration of pastoral care with other means of care, such as community outreach and a means to fulfilling one's faith. So we kind of, help guide that message along. And what you were saying about all those numbers, we have to continue with that conversation ongoing. So the more that we talk about it, the more people will learn, the more people will become educated, and we're hoping that we'll decrease those numbers.
Okay. All right. Well, speaking on that, what has been some of the health initiative you've championed the last few years? Well, you know what? Yeah, for that. Yeah, I'm doing that. And then I guess as you know what? Wait a minute. You know what? You made me think about something. Let the preacher me come out, okay? You said faith community nurse. Hold on now. Let the preacher come at me now. How do you integrate faith in your work? And has the faith impact? I mean, do you pray with folks? Do you share scriptures? I mean, are you limited? I mean, how does this thing work with the faith?
We out here doing it all. We are out here for the people, out here on the streets. We're praying with them. We are giving the message. We're meeting them where they are. So we're doing it all. We're doing it all. We have I'm just really proud of the fact that we have in Detroit, I have at least 20 congregations, maybe about 5 or 6 that are a part of the convention. And I also have a network in Macomb County, and we have about 20 churches there as well. And we meet once a month. We share resources, we work with the community, but this past year, we have really bumped up. You think that COVID restricted, it did not.
Did not, praise God.
I would just like to shout out some of the things that we have done.
Wow.
You want to hear some of the
things?
Go
ahead, got me excited, go ahead.
Some of the things that we have done during COVID, when it first happened, people were really, they didn't know what to do. So I brought in people that CEOs of the hospital to come and talk to you, let you know what's going on in the hospital. We had Zoom meetings with people, especially Christian came in and talked about the American Heart Association and COVID with heart disease. we've had the churches that integrated with Gleaners and Forgotten Harvest and delivering food. I want to shout out one of my nurses that is now working to help make sure that the churches are sites for COVID-19 vaccines.
Awesome.
Latanya Davenport, I know you out there over at El Bethel, and she is working to help us to integrate and make sure any of you nurses, any of you churches in Detroit, if you are interested in becoming a host site for COVID-19 vaccines, we will help you start that out and get that going. We're doing COVID testing. We're doing what else? We're doing the COVID testing. In fact, we've given out hand sanitizers, masks. If you need it, we got it.
Wow.
So we have all the resources that we need. And we're also having opportunities for some of the churches that have applied for grants and have received them to be able to continue to work within their congregations.
All right, that's Detroit. And also for those that nationwide, if you're interested, just email us at info@hopenbc.com. That's info@hopenbc.com. And we try to work with you where you are. Okay, now that's great. Now, what have been some of the major initiatives that you've championed over the last few years?
Well, I would say last year we partnered with the American Heart Association to attack and make sure that people are aware of hypertension. And they rolled out a hypertension self-management program where we equip they equip the churches with Chromebooks, apps, and information on how to educate the parishioners on monitoring their blood pressures, even giving them blood pressure monitors to be able to do that. We're continuing that work. We've worked with the American Cancer Society, and they have given us materials on cancer. And right now we're in the process of making sure that the mobile mammography mobile will be at your churches if you need them there. They will be giving out mammograms for free. So, you know, whatever the needs are, we try to address that and work with the churches and make sure that they are connected to these resources for their congregation. No congregation is too small. We work with small and we work with them all. So
look, she got it around me, y'all. Work with them small, work with them all. Look at y'all. Okay. And look, for those that are not in the Detroit area, remember your local hospital, if it's a nonprofit, they probably have some resources, including a mammo bus. You just got to make the contact. And please don't go begging at them and don't go talking about them. Work with them. Just like Janet's doing. They love her over there at Henry Ford. Okay. And she didn't pay me to say that either. All right. Now, let's check this out. Now we're talking about this stroke. How did you become involved with this Power to End Stroke initiative from the Heart Association?
Well, I care about my my church members. I care about my family. Heart disease has impacted my family. My mother had a heart attack early on, and my father had hypertension. When I first started working with the congregation as a faith community nurse, that was one of the initiatives that, that every church has a blood pressure Sunday, right? Just about every church takes blood pressures. But when you take the blood pressure, you want the education to go along with it. So that's what kind of prompted me to start doing that. And in 2018, I had a heart incident. I had an incident where I didn't know that I had a condition that when my doctor told me I could have dropped dead if it had not been treated.
I'm glad you didn't drop dead.
I didn't drop dead. God saved me. But those are some of the things. It's personal to me. It's personal to me because of my people, and I love my people, and I know that that's one of the number one killers of our people is heart disease. So that's how I became involved.
All right. So now, when is Power Sunday? We've been talking about that. When is Power Sunday this year?
Power Sunday is May 16th.
The third Sunday.
Yes.
Sunday after next.
Yes, for our church. I think each church can pick a Sunday. So if you don't do it on the 16th, you could do it the next Sunday. But 16th, the 15th is the Heart Walk here in Detroit. And that's one of the big fundraisers. They will be talking, Christian and Michael will talk about that. but Heart Walk. So we want to, I have a team at New Calvary Baptist Church where Team Health Matters. I sowed a seed into our initially for us to get started, and I'm gonna challenge everybody that's on my team to put some change in it. And we're gonna walk. We're gonna walk virtually. Some folks will walk virtually, but I'm going down to the DeQuinder Cut. If anybody wants to meet me at the DeQuinder Cut and then go shopping at the Eastern Market afterwards, hit me up. Come on through.
Don't tempt some folks. They might jump on a plane and go get with you from down there, that other way. But look,
Eastern Market is the spot now. Eastern Market is the spot. DeQuinder Cut too.
All right. Well, look, for the National Baptist, we have designated the third Sunday. I see folks here from Florida, from Arkansas, from New York, other places, but we're trying to get everybody that can the third Sunday to do your Power Sunday thing. All right. Well, what are some of the Power Sunday activities that people can do that night?
Well, when you get that toolkit, there are so many different things that you can do. Even the pastor has a script. So all you got to do is just get your little piece of paper, talk about it on Sunday, the statistics, put it in your bulletin. There's so many different things that you can do. And I don't want to take away Michael and Christian's thunder, but yeah, there is a toolkit. I don't know if you're going to upload that or not.
Yeah, we have the old one, and we're gonna, as soon as it's done, we go upload the new one. We were so glad, we were glad to get the new one. I did one of them little Holy Ghost dances because the one we had about 4 years old. So
yeah.
I know. Look at Christian, like, oh, that's all right. We got the new one now. That's all right, Christian. We got the new one now. Okay, all right. Is there anything else you want to share before we get off, other than you and Teresa, like salt and pepper? They go together.
That's my partner there, Teresa. I'm gonna be nice. I'm gonna be nice. Teresa, be nice tonight. But I just want to say that my network of nurses and health ministers through the Henry Ford Faith Community Nursing Network is awesome. They do great work, and we all work together to make sure that our members and our community is well educated and informed and equipped. So, I mean, you won't come to my church unless if you come to my church, I'm gonna hand you a mask, a hand sanitizer, and a box of food.
Wonderful, wonderful. Thank you so much, Janet, for sharing on tonight. All right.
Thank you.
All right, now we're moving on. We're moving on up. All right, let me bring up Christian. All right, let me add the spotlight here. All right, Christian Hurley, she's American Heart Association Metro Detroit Executive Director. Christian, welcome to our webinar.
Thank you so much for having me. This is so exciting to be here. I'm always happy to be here with my buddies, Janet and Teresa. We've done so much work together in the community. And so any opportunity to share with you all, I'm happy to be here. Thanks for inviting us.
Wonderful, wonderful. Well, look, let me go right to the big important question. Now, what does it's like a big time thing now. What does the executive director do? And Detroit's a big area. It's not just Detroit. What do you do?
Yeah, so I mean, ultimately, I think to make it really simple, I think the ultimate goal for me and for the American Heart Association is really to build culture of health, and when I say culture of health, it's about sort of transforming communities so that the healthy choice is the easy choice, where people live, where they work, where they play, where they pray, and where they learn. So what can we do in those environments to really ensure that those environments are supporting a healthy lifestyle and helping people to sustain it as well? So everything that we do at the American Heart Association, I feel like comes back to that basic tenet of just inspiring longer and healthier lives.
All right, so you sound like you're the lead cheerleader. Okay, all right. So how's your previous experience that you have the associates helped you in your current position?
Yeah, it's invaluable. I mean, it is, I've spent the past 9 years working in communities, as Janet said, doing self-monitoring programs for high blood pressure. High blood pressure is the #1 indicator of
Okay.
whether or not someone is going to have a stroke or heart attack. And so we found early on at the American Heart Association that if we can make an impact there in blood pressure, particularly in Black people, because we have the highest rates of high blood pressure in the world, we can make an impact on outcomes as it relates to stroke and heart attack. And so, I mean, being able to be on the ground, being in those congregations, talking with people, seeing the need, right? Makes what I do now, sort of overseeing all of the work of the American Heart Association, it brings it to life. And I think it really allows us to ensure that all the work that we're doing, everything that we do at every level, from Go Red for Women, our Heart Ball, our Heart Walk, as Janet talked about, that everyone has an understanding of how we are leveraging these dollars. When you're doing Heart Walk, you're not just walking, you're creating a life-saving difference for individuals and communities. And I think, you know, being in that role, having that opportunity to build these relationships and seeing how the work that we do, you know, truly does save lives, it's very impactful. I'll share just a quick story. You know, just last year, we did a blood pressure self-monitoring program. This was back when I was in my previous role. And I got a text message in the middle of the night. You know, like, who is texting me? And a lady who was a part of one of our self-monitoring programs was texting me to let me know that she'd taken her blood pressure and it was incredibly high, and had reached out to her federally qualified health center that, you know, we were partnering with on this initiative, and they told her to go to emergency, and she did, and they found that she'd had a stroke. She'd had a mini stroke.
Wow.
And so by her going in, people don't know, but a mini stroke often will precede a massive stroke, right? And so the fact that she was checking her blood pressure and she knew that it was out of hand, and she reached out to her primary care physician, she got the help that she needed. I mean, that's a life saved. And so being able to take that kind of experience into this new role, again, it just fires up my own passion for the work that we do. But it just allows me to ensure that those kinds of stories, the stories of the people in our communities who need the work and the support and the resources that we're bringing, that those messages are heard so that we can raise the funds that is needed to continue to support those programs.
Wonderful, wonderful. Some of that, what are some of the key initiatives that you all are doing there in the Metro Detroit area?
Yeah, absolutely. So, you know, everyone's familiar with the basic stuff that we do, right? So the American Heart Association, you know, funds, you know, billions in research, right, for heart attack and stroke, right, nationally. But we also do a lot locally. We do a lot around what we call our social determinants of health, which you guys are all familiar with. And so how can we work in communities to ensure that, again, that those environments are supporting healthy lifestyles? So it's hard for people to exercise at home if they don't have a home. So we work a lot in, you know, we want to make sure that everyone has access to affordable and safe housing. So we have it just recently, and I don't want to steal Michael's thunder because this is really his baby. He just did a great program with our faith community on inspiring affordable homes and actually having congregations build on property that they own in the community. We also do a great deal of work around what we call policy systems and environmental changes. And so, for example, we have an initiative in the city of Detroit that works with early childhood education. It's called Healthy Way to Grow. And so we are partnering with 43 early childhood centers in the city, and we're helping them to build actual, again, that environment. What does your center say as it relates to what these kids should be eating every day? Do you allow them to bring sodas in? Are you serving them juices? What do you eat? What are you feeding them? So we help them build policy around the food that is being offered, how much physical activity the kids get, how much screen time they're getting. Surprisingly, people show, you know, kids in early childhood centers, they'll put them in front of a TV, right? And so we have to build policy and provide education around, you know, how much is healthy. We also work with them to ensure that the things that the kids and the teachers are learning in school are making at home, and ensuring that the families are creating that healthy environment at home for these kids who are 0 to 5 years of age. And during COVID, that was also interesting. We found a lot of families were struggling, as we all know, with food support. So, you know, as Teresa said, the churches are getting involved, making sure they're feeding people, but we had families coming to the center and sharing that they could use some additional resources. So we were able to leverage some of our partnerships to provide fresh fruit and vegetable boxes to some families who were in need within that program as well. So that's just a couple of examples. And then of course, we got all the work that we're doing in the faith community and our self-monitoring programs and work around hypertension, cholesterol, and diabetes that we work on locally in our market as well.
Wow, I want to give a shout out to the thing about that 0 to 5. I know in our area we have the Excel to 5. I think Pastor Andrew Miller, he's an alderman down in our local area. So I think the church need to jump on that first thing, because Christian, I almost cried a couple of years ago. I had a young lady in my church. She was like 4 or 5 and couldn't read. So we get our work cut out for us. I like that. But look, what is Power Sunday?
Yeah, so, Power Sunday is an opportunity for congregations to, well, first of all, May is American Stroke Month. I don't know if we've said that, but it's American Stroke Month.
You just said it.
Yes. Okay. So this is the opportunity for all folks in America to be really taking the time to learn about stroke, right? Learn about the warning signs and the risk factors and how they can reduce their risk. And so Power Sunday is an opportunity for our congregations to pick a Sunday in May and say that, on this day, we are going to make absolutely sure that all of our congregants are aware of the risk that they have for stroke, particularly in our Black and Brown communities, that we're providing them the resources that they need to learn how to start making healthier choices. And so, as Janet said, there's a toolkit that's involved that provides you ideas on how you can engage your congregation, messaging for your pastors and for your leadership to really be able to support that healthier lifestyle. So that's Power Sunday, just an opportunity for us to ensure that everyone has that baseline understanding of what they need to do to ensure that they're lowering their risk factor.
All right. And to be clear, this is a nationwide initiative.
Yes. Oh, yeah. So, it's through our Empowered to Serve initiative through the American Heart Association. I would highly recommend everyone visits the empoweredtoserve.org website. There are all kinds of resources there, which Mike will share more about as well. But you can find additional resources for congregations there as well, all over the country.
So you mean that once we and look everybody, we're going to update it and have it uploaded in the morning. So you're telling me that when they get this toolkit, it'll give them some things they need to do to help host a wonderful Power Sunday?
Yes, absolutely. Yes. And ask Teresa and Janet, they've been doing Power Sundays for a decade, right? And so they know. And, it's really use your own creativity too. What we give you in the toolkit is ideas. Here's some things you can do. Here's some recipes. Here's some great ideas. But, build upon that. You've got faith nurses, have a screening for blood pressure, right? Bring in some additional resources. We've got all these mobile units now doing, COVID testing and providing fresh food. People just kind of use this opportunity and build upon it. What can we do on this day and really make sure that we provide people the greatest and deepest level of resources and support that we can. So don't be limited either by the toolkit. Let it kind of give you some ideas and build upon that and let it inspire you to really make something fun for your congregation.
Well, look now, is there anything else before we go to Michael? Is there anything else you want to share tonight, Christian?
Again, I just would love to thank you all for having us, for highlighting this incredibly important issue. I cannot say it enough. This is so important, particularly in the Black community. And so kudos to you for having this event. Thank you for having me. Thanks for letting Michael come in and just for us to be here with you all to share the knowledge that we have. And so we appreciate it. And if you need anything, when you said 4 years since you've had an updated toolkit, oh my goodness, call me. Give us a call. Email me or Michael. I'll make sure that we add our emails into the chat. Let us know if you need anything, if you need resources, a toolkit on almost anything as it relates to health. The American Heart Association has resources. So please see us as a resource for you. Don't wait 4 years to get updated information. Reach out. Okay.
Thank you, Kristen. All right.
Thank you.
All right. Well, now we're moving on up and we're going to bring up the other Michael.
How you doing, Dr. Miner? Thank you. Thank you again for the opportunity.
Yeah. All right. Well, look, it's got to bring Michael up here. Wow. Michael, now what does a director of community impact does? I'm just trying to put my arms around that message. All right, he's gonna show us, y'all. Now
So
look, y'all take some
let me
notes.
share my screen. Here
Go
we
ahead.
go. Everybody
All
can
right.
see? All
Yeah, I can
right.
see.
So a little background on myself. I'm actually an urban planner by training. And I've worked for years in the space of public health, but I've also worked for Habitat for Humanity. I've worked for community development departments. And it wasn't until I joined the American Heart Association where I was able to make both of those worlds collide. And really, it's based on this slide that you see right here, because what we find is that 80 to 90% of an individual's risk factors when it comes to cardiovascular disease and stroke are factors that are outside of the clinical setting. So when I say the clinical setting, what I mean is access to quality care, access to a primary care doctor, a specialist, or a cardiologist. Those factors only make up about 20% of an individual's health, or the spectrum of health that we call. The other 80 to 90% are factors like health behavior, factors like physical environment, air quality, housing, transportation. Do you live in a food desert, right? Social and economic factors like education, employment or lack thereof, income, family and social support. These factors are disproportionately impacting an individual's ability to lead a long and optimal health free of cardiovascular and stroke, right? So what Christian has been talking about, what Janet and Teresa have been talking about, is our community effort to work in these spaces to come up with innovative solutions to the social determinants of health, right? If we're gonna actually move the needle forward, if we're actually going to stem the tide of stroke and heart disease, especially in the African-American community, we have to look at these factors, because we know that our community, unfortunately, is going to be disproportionately impacted by these factors, right? And so as the American Heart Association evolves our mission to create a world of longer and healthier lives, we have to look at these factors. Like Christian mentioned, we also still fund billions of dollars in research, right? Research to make sure that when you come into the clinical setting, you have the optimal care around hypertension and cholesterol management, right? But if we're gonna have to work in these factors if we're actually gonna move the needle forward. And how we're doing that is, again, changing policies on a local, state, and federal level, right? Making the healthy choice the easy choice, right? But that doesn't really happen by osmosis, right? And it doesn't happen out of the kindness of people's heart, right? I'm a Christian, you all are Christians, but unfortunately, policy needs a little nudging, right? So we have to continue to change policy on all of those levels if we're gonna make changes in terms of people's health. We have to continue to lead and break through in technology, right? The pacemaker, more technology around blood pressure management. I've even heard of wearable technology, rings and watches where people can monitor their blood pressure, right? That's coming from the American Heart Association with our research and making sure that we break through in science and technology, changing systems within health systems like Henry Ford, our federally qualified health clinics around Southeast Michigan and are really around the country, making sure, again, that when you enter the clinical setting that you receive the best care possible. And again, transforming communities with our blood pressure initiatives that we've been doing with Janet over the years and working with schools and places of employment, really, again, building that culture of health. And really that's the goal, is to figure out how all of these factors work together: air quality, housing, transportation, walkable spaces, right? Pedestrian walkways, bike lanes, right? All of these things work together if we're gonna actually create an environment that's conducive for long and healthy lives. And when I think about our 2024 goal of increasing life expectancy, right? That's a big goal, right? And again, going back to the social determinants, if we're actually going to increase life expectancy, especially in the Black community, we have to be bold, right? There's probably a time when we would mention, we're doing a faith-based housing initiative. People may have looked at us funny and said, what is the American Heart Association doing when it comes to developing affordable housing? Did you know that housing is one of the leading social determinants, right? And so like Christian mentioned, How healthy can you be if you don't have a home? Or how healthy can you be if you can't afford that house, right? Or if you're living next to an incinerator, right? Or if you're living next to other environmental hazards, right? And so again, if the American Heart Association, we're going to be true to our mission, which I know we will, we're going to have to be bold. And I know we can do that with partners like you all that's connected to this call online. So that's what we're doing. So in a nutshell, that's what that's what a community impact director does, is really look at these large systemic issues and figure out how we can make changes.
Right. Well, look, could you share a couple of stories? Of course, not giving their personal valuable information, but a couple of stories about some of the things that you've interacted with and some of the people you helped as a consequence.
Absolutely. We were able to partner with a fantastic volunteer by the name of Steve Sarnes out in the Ann Arbor area with one of our initiatives called Adopt a Clinic. And essentially what it is giving blood pressure monitors and educational resources to patients that are patients at a federally qualified health clinic called Packer Health. I was very instrumental in getting that gift to come through so we can support these clinics. And I was able to do that through a story. And the story was when I was a community health worker, I had a particular patient that wanted to monitor his blood pressure at home, but could not because he was dual eligible for Medicare and Medicaid. But for whatever reasons, again, going back to policy, Medicare and Medicaid do not cover blood pressure monitors in some states. So this particular patient was not able to procure a blood pressure monitor. And so I, just being the person that I am, seeing barriers, I just went to the local durable medical equipment supplier and I bought one for myself. And that, I remember, standing on his porch and it brought him to tears. Because I left and say, we can't help you with this. And I just came back, knocked on his door with the blood pressure monitor, and I was able to give it to him. And I was able to share that story 4 or 5 years later. And we were able to support over 500 patients now getting a blood pressure monitor. And so I can't remember that patient's name, but I don't know if he realizes that his story and what I was able to help him with, again, breaking those social determinants on a very personal level, I was able to share that story and now impact more lives and potentially save lives, because we understand that self-monitoring blood pressure is your #1 line of defense for reducing your blood pressure, right? And so if we can get patients, like Janet was saying, if we can get patients to understand the risk factors, understand the importance of self-monitoring along with the education, right? It's not enough to know you're hypertensive if you don't have the education and the support system to help you. But now we're able to continue that based on that story. So this is real life. This is what it looks like in real terms when we talk about social determinants and these barriers that exist and how we're breaking them through our awesome volunteers.
It sounds like to me your recurring theme. I'm gonna put a challenge out here. So several pastors and other people that are close to their pastor on our webinar tonight. It sounds like some of our churches need to purchase some blood pressure cups.
Absolutely, absolutely. Because the barrier still exists. Especially if you're on a fixed income. If you're receiving Medicare and Medicaid. I know every state is different. I know we have representation around the country. But a lot of it is based on advocacy as well. So, purchasing the blood pressure monitor, but also working with us in terms of advocacy, those stories can make it to a state house. It can make it to a federal, the federal government when it comes to CMS, Medicare and Medicaid, and making sure that health plans like Medicaid and Medicare or other HMOs cover this very vital life-saving instrument in a blood pressure monitor.
Well, how do your efforts support Power Sunday?
So just like this, making sure that we continue to connect with the community. I'm going to get my church involved in this because it's very, very important. And so when it comes to our faith-based partners, Janet would tell you, these are the most vital partners we have in the community. right? This faith-based housing initiative that we were able to get off of the ground, it was only made possible by the work that Janet and Teresa and Christian have been doing over the years, using those same inroads that we created with these partnerships. We go to our faith-based community first when it comes to connecting with specific populations, because you all have the trust and you all have the built-in mission. So it starts with things like this, just having the conversation, but making sure we get you the up-to-date information. You know what I mean? We don't want you with a 4-year-old toolkit, you know what I mean? But also, you know, creating these lines of communication and encouraging other people to join as well.
All right. Was there anything else you want to share? Anything else you want to share that we didn't cover? Absolutely.
So I'm just gonna, I do want to share just a few ways that you can get involved. Of course, we talked about the Power Sunday Toolkit. You're the Cure is our advocacy arm. So I talked a lot about advocacy because it's very, very, very important. And many voices make a difference. Many voices make a difference. And so I encourage you to go to you'rethecure.org and get on an email or a mailing list to be up to date with what's going on in terms of grassroots advocacy in your area. We also have Empowered to Serve modules, and they're just as the name implies, Empowered to Serve. These are prefabricated health and wellness modules that are available to you all, and they're designed to be led by the community, right? Oftentimes, Christian and I will come and maybe do 1 or 2, but the goal is to transition that module to a local leader that has the trust of the community. So these are prefabricated modules that are all science-based, right? Around health and wellness and our Life Simple 7. So I encourage you to reach out to us to get those modules, or you can go to empoweredtoserve.org to get those modules as well. And this is your, this is the local Detroit community impact team, myself and my counterpart, Mitzi Cardona. But, Dr. Minor, connect with me and we can try to maybe figure out how we can connect with local community impact teams around the country. There's CI teams around the country, right? And we all essentially have the same mission and the same mandate, and that's to connect with community leaders to prolong our mission. So this is the local team. If we have any local Detroit churches on the line right now, but Michael, let's get together and figure out how we can connect other churches with local CI teams to get these resources.
That sounds like a plan. It's like a plan. Michael, I appreciate you. You can't be too bad, man. You got a name like Michael. That's all right with me.
Absolutely. Thank you, Dr. Money.
All right. All right. Look, well, a big thanks to our panelists. We've covered so much so far, but the best part is coming now. We want to hear from you. Those of you on social media, and I've been checking back and forth, quite a few people have been watching this on social media. You may type in the chat or raise your virtual hand, and we'll see can we unmute you. And those on social media, we can do the best we can to capture your questions. Look, before we go any further, we also want to remind you about one of our newest initiatives, the National Institutes of Health All of Us Research Program. The NBCUSA is an active participant. The program is conducting monthly surveys during the pandemic on how people are coping. And we hope that you'll participate in this and that you'll become 1 in a million. If you'd like to learn more about this effort, email us at info@hopenbc.com. All right. Some questions. Oh, okay. All right. Let me bring in our panelists so we all can be up. All right. And we add the spotlight here so everybody can be up here and we can be in the mixed. Okay. And not forget Michael. Okay. All right. So we have a question here. I guess this must be for Christian and Michael. It seems, I guess I put this diplomatically? It says, seems like you all are so excited and do a whole lot of things with your group there in Detroit, but it doesn't seem like it be the same in other parts of the country.
Well,
sounds like some shade to me, man. Anyway, go ahead.
Well, I guess if it seems like we're focused on Detroit, it's because that, I run the Detroit market, but there are staff from the American Heart Association all over the nation. And so if you were to let me know where you are, I'm sure I could find a community.
I don't think they're gonna do that. I think that was just kind of like a thing that said that maybe they had a bad experience or something. I don't know, but I thought
Oh,
I felt
boy.
the shade. I felt the shade.
Well, I hope that's not the case. But again, you utilize the resources on the website. And it is true. Not every single city has a community impact director. And actually, our team here in the Metro Detroit area, before I left my role, there were 3 of us. That's unheard of. There's very few communities in the nation where there are 3 staff people working on community impact. And oftentimes there might be one who's servicing multiple cities. So definitely reach out to the AHA wherever you are, but leverage the website. That's one of the reasons why they've created such a dynamic website with empoweredtoserve.org, because for those communities that do not have staff, they wanted these congregations to still be able to engage and receive these resources. So there's a plethora of things on the website that you can engage with and networks that you can tie into right online virtually.
Okay. All right. Janet, somebody asked, would you mind typing your email address or sharing your email address if they wanted to pick your brain about some things? Is that possible?
Yes.
All right.
Should I put it in the chat?
Put it in the chat, and then Sister Copper, remind me. I'll put it out on our Facebook thing too as well. All right. All right. I guess you got some people really all fired up there, Janet.
Yeah, come on with it.
Okay. All right. So Teresa, they're asking now, what if you're not a nurse? You do all this training, whatnot. What if you're not a nurse? Is there a place for a person that's not a nurse to do this thing with this health efforts?
Oh, absolutely. As Janet said, we use laypersons also. You do not have to be a nurse to be a part of us. All you have to do is be a person that loves people, have a willing heart and spirit, love the Lord, and we're going to see to it that there's work. Remember, there is plenty of work in the vineyard. We just don't have enough people out there to get in the vineyard. So come on with us. We'd be more than happy to have you. And if you are within the Midwest region, please, 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 I ask that you reach out to me so that we can start putting some things together so that by the time Dr. Minor takes us back to in-person with Dr. Young, in-person convention, June 2022, we can really show them what we've been doing. Praise the Lord.
That sounds like a challenge. All right.
Yes.
And don't forget, for those that are watching anywhere across the country, we will have our monthly meeting for Hope on the second Thursday in May 13th. And if you're not already on our contact information, email us and we'll get you the Zoom link. All right. So Michael, there's a question about the 2 different kind of P's for policy, the little P policy and the big P policy. Some people are concerned about that big P. They don't want to go up to the State House. But there's some things they can do in the little P policy that can be helpful.
Absolutely. They're both equally important, especially when it comes to what we experience in Michigan a lot is preemption. So oftentimes there are local organizations or even local planning commissions or city councils that may want to go forward with a local policy, but they're preempted by a larger state policy. So I would say whatever your bandwidth is, whatever your capacity is, and whatever your network lends you, work within that realm of influence. There's no such thing. I know we distinguish big P and little P, but I've seen acts of local legislation make a big change. I've seen small neighborhood associations with 4 or 5 elderly people make a huge change as well. So when it comes to the American Heart Association and our overall mission of a world of longer and healthier lives, all of these policies are equally as important. So I hope that answers the question, and I hope that it's inspiring as well. Work within your influence, work within your network, and all change is big.
All right. All right. Well, I think that's all the questions that we have, and we look like we're still ending up on time. We try to keep this to an hour, but I want to thank you, Kristen, Janet, Teresa, and Michael for joining us on tonight. We hope that you will hang tight, because what we always do once we go off live on our social media. We do allow a few minutes for those who are on with Zoom to interact with you all. So just hang tight here a second. And we're going to get ready to wrap up the first part of this thing. This technology, a year ago, I barely knew what Zoom was, and now I'm directing stuff. Well, Lord, there is a God somewhere. Okay, all right. Look, we're reminding about our upcoming events. We're continuing this theme for American Stroke Month on May 18th. That's right, Tuesday, May 18th at 7 p.m. Central Time, 8 o'clock Eastern. We're going to have another stroke awareness webinar from Team Louisiana. That's May 18th. For those of you all that are on our regular mailing list, we'll make sure to share the information with you. Then on May 20th, that's a Thursday, the same week, we're going to do our second in our Turn Obesity Around series. And the Turn Obesity Around series, this time will be in the Southwest for the Southeast region. That's Thursday, May 20th, 8 o'clock Eastern, 7 p.m. Central. Don't forget that not only is May American Stroke Month, Power Sun is coming up, but it's also National Mental Health Month. Hope that you're doing some things to emphasize the importance of our mental health wellness, especially during this pandemic. Sunday, of course, begins National Women's Health Week. Begins with Mother's Day, May 9th through 15th. And for the National Baptists, we know that Mother's Day is also Bells for Remembrance, where we are hoping that mamas and daughters will get together and have their mammograms. All right, you can join us on social media. We're on the web at hopenbc.com. Let me slide which way? Let me slide this way. There you go, hopenbc.com. You can go to our Facebook page, which is National Baptist Convention USA Incorporated, Hope Health Initiative. We're on Twitter and we're on YouTube. And we got a survey, the survey that we want you to complete. I want y'all to know that the biggest room there is the room for improvement. So when you finish off this webinar, we're gonna make sure that we do that. All right. And I want to give a shout out to our team, to Lottie Minor, I might know her, to Pastor Bernard Montgomery, to Sister Bettina Campbell, Pastor Dexter Moraney, Sister Ellen McKnight, Sister Dr. Felicia Washington, Minister Geraldine Moore, Dr. Desi Levy, Sister Linda Copper, Sister Loretta Miller, Dr. Lavora Williams, and Sister Michelle Johnson. All right. Once again, we want to acknowledge our president, Dr. Jerry Young, who reminds us to envision the future exceptionally. This has been a production of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. God bless and keep you